Okay, so the final Bethany will be Tuesday to Wednesday, and I'll say more information about that. So starting off by what is a necropsy, and a necropsy, if we look at an animal, but after it's died, when we have to examine an animal that has died. I know in people, they use the word autopsy, and autopsy means seeing with one's own eyes, but usually autopsy is used in people. Necropsy is used in animals. I mean, so it's a similar process. You're going to be looking at a deceased person as an autopsy, looking at a deceased animal as a necropsy. That's the difference. But what we're trying to do is look at any abnormal changes to the body after the animal, you know, well, the animal has died, but do we look at anything internally that probably caused, like, okay, I'll give you an example. Say an animal's owner, or they bring in their dog and it died in the yard. And then when they bring the animal in when it died, sometimes they want a necropsy in the clinic by the doctor. And I've helped with these and while I've been in practice. And say you open up the belly and it's full of blood and the spleen has tumors. You can kind of go to the owner and say, okay, it looks like your dog had splenic tumors that ruptured, and unfortunately your dog suffered a bleeding event and died. Because, on the outside, maybe the dog looked fairly normal. And I will say, after years of ER experience, a lot of times splenic tumors, because the spleen is up under the rib cage, sometimes the spleen, when it grows tumors, they don't push out. And the owner, it's not their fault. Sometimes those animals are good at holding or hiding disease until they're very, very sick. And so if this owner comes in and they're like, yeah, I want to know why my dog died. Now, some people will just bring in an animal that died at home and they're like, I don't want to know. But sometimes we will offer to do what's called an informal necropsy, where the hospital doctor will just open and kind of look around. Does the heart look normal? Does the spleen look normal? Do the lungs look normal? And you're kind of trying to look and see, are there any disease changes in the obvious body that we can detect? Now, there's the higher level necropsy where we would send a bunch of samples to the lab, and we may have to have the lab help us. So there's kind of two forms of necropsy that we're going to talk about. Now, sorry, get my arrow. You have to talk about some of this vocab. And again, if you guys open these PowerPoints in the notes view, you can see the gray box underneath. But pathology is the study of disease or abnormal conditions. So whenever someone studies pathology, but this class, it has been the pathology of the endocrine system, the pathology of the integument system. It's like, what are the diseases or the abnormal conditions that affect? And pathology is the study of that, study of disease. You talk about what's called gross pathology. And anytime something is gross, you can see it with the naked eye. So for the example I just gave you, if a dog dies in the backyard and the doctor opens it, grossly, we can see the abdomen is full of blood, and we can see there's tumors on the spleen. We don't need a microscope to see that. That's an example of gross pathology. I can see there's abnormal pathology to the spleen. So I hope everyone makes sense with that. Now, histo always pertains to tissue, right? So when you do histopathology, these are changes to the tissues that are microscopic. So say, for example, if I use the same scenario, and maybe there wasn't obvious tumors, but the doctor decided, let's take a piece of the spleen and send it to the lab. And then they will look at it microscopically and say, are there any changes in the spleen, microscopic changes that would explain the disease? So that's the difference between And you will need to know this for the test. What's the difference between gross pathology and histopathology? Gross is abnormal changes that are visible, and histo is changes that are not visible by the naked eye. You need a microscope. Now, the other thing, when we do a necropsy, and the first thing you look at inside is, are there any lesions? And a lesion is just an alteration or an abnormality in tissue. Now, you have to kind of know what normal is. Like, you guys probably don't remember from, I don't know, maybe you do an anatomy. Do you remember what color the liver was? Do you remember what the liver looked like? Can anyone tell me what color the liver was? Or what's normal liver color? Yeah, it was kind of dark red, brownish. Now some of your cadavers were a little altered, so the person, but normally if I open an animal, it should be like a dark red, like a maroon color. And normally an organ like the liver or the spleen, normally the tissue should be smooth and it should be of the same texture. But what if we open an animal and there's a bunch of yellow spots on the liver? Would I expect to see yellow spots on a liver? Or, yeah, no. So if I see yellow spots on a liver, those could be lesions. Now, sometimes the doctor might guess. They might say, well, this animal, if they had hepatitis, sometimes animals that die of hepatitis, they may have lesions on the liver. So sometimes a doctor could guess as to why there's lesions, or like sometimes they'll have abnormal spots and it's cancer. Hold on, he's getting into something. Oh. Hey. I just busted him and he dropped that stick. I thought he was getting into my old coffee cup, but he got a stick from the basket by the fireplace, and AJ just turned around and dropped it like a kid that was just caught with something. Oh, that was so funny. Sorry. Okay. So one thing that we look at maybe right off the bat, first of all, as soon as you open an animal for a necropsy, do the organs look normal? Is there anything grossly abnormal? And again, a doctor, you need to know what are normal appearances to these organs. Like the lungs, typically when an animal is deceased, they kind of get flat. They're not really nice and spongy pink anymore. But if we see a bunch of black spots, we would know that's abnormal. If we see scar tissue on the heart, that would be so those are examples of lesions. And then when we talk about pathogenesis, well, path is disease and genesis is kind of the start of or creation. So pathogenesis is the sequence of events underlining a disease, or for the underlying disease. For example, if a dog dies of leptospirosis, well, if you go back and the owner 2 weeks ago, dog played in a pond, drank water, 5 days later, fever, vomiting, goes in, abnormal lab work, hospitalized, moves into renal failure, dies. So the pathogenesis is what is the start of the illness that caused the disease. And again, something can be pathogenic and they don't die from it. I use the example because we're talking about necropsy, so I'm talking about dying, but it can actually just be from the beginning of a disease to when it causes advanced illness. So again, normally when we do a necropsy is to determine a disease process because it helps understand. And also it does help, what was the process that led to death? So for example, the owner wants to know, why did my dog just drop dead in the yard? Well, your dog had a splenic tumor. It probably ruptured. and then the bleeding went into the abdomen, and then the dog went into cardiac arrest. So we're like, this is probably the process to why your animal died. And especially owners where sometimes it happens so acutely, because I will tell you, again, sometimes dogs with splenic tumors can look very, very normal, and then it hits them like that. And so sometimes when something seems sudden, people are more willing to want to do a necropsy because they want to know why. What is the accuracy of the diagnosis? So, because, if whenever we presume illness, we go off of clinical signs and lab work, but obviously a necropsy is going to get to the real reason that there was an illness. There's always suspected, and then there's the actual evidence of the disease that proves the diagnosis. It does help, if we talk about positive, negative effects of therapeutic measures. Now, again, sometimes you might do a necropsy on one animal that died in a litter, but also knowing what happened for sure is, and maybe you treated with this, we're going to change the treatment process for the other puppies that are still alive. So we're kind of evaluating therapeutics by doing a necropsy. But also, when we talk about necropsy, unfortunately, when we talk about developing pharmaceuticals, they're tested in animals, and they will collect tissues to talk about, does that drug effective or not? Did it affect the liver? Does it affect the kidneys? When a drug is going to go to market, it has to go through all those steps. So necropsy is a part of that. But the other reasons that are listed below here, if you have multi-animal households, because if you have one die, and then especially the two other dogs start coughing, and maybe the one that died was coughing and these two are alive. So we need to find out for sure what happened to the one that died, because we don't want the others, potentially. So especially if one animal died and in a multi-animal household, multiple ones are showing signs of other illnesses, or the same symptoms, but we talk about farms and lab facilities, because especially if you have when you work in a laboratory, you have animals in close quarters. If one dies unexpectedly, like I said, you don't want to run the risk of the whole facility getting infected. And maybe you need to do a necropsy because you don't know why. Maybe you do know why, but a necropsy is always going to confirm. And then, are any other animals at risk of infection? Inherited condition. Again, if, a lot of times if a puppy dies prematurely, if we know that it died from something it inherited from the parents, maybe they won't breed those animals anymore. Maybe we give that feedback to the breeder and say, no, they carry this gene, they carry this mutation that caused this illness, therefore we shouldn't do it. Toxins, environmental hazards. So again, if there's anything, you always look at what you can see when you do a necropsy, but when you sample tissues and bloods and fluids, then you're also checking for toxins. And maybe that's to evaluate, say you have a farmer and then a bunch die in a herd, and then they know there was like lead poisoning and it's in the water on their farm. Like, that's an example. They probably, so you'll send in the animals that died. They all have high levels of lead. You go back, you can, test the farm. That's a way, because that's a toxic metabolite in that animal, and we want to protect the rest of the herd. So these are all reasons, and be familiar with reasons to do this. So when we do a necropsy, we are looking at first of all, yes, and this is why I've told all my students that take anatomy and physiology, it is the basis for all your classes, because now we're going to do a necropsy and I'm going to be like, show me the liver, show me the pancreas, show me the heart, show me the lungs. Where's the cecum? What joint is this? So you have to know anatomy and physiology. You have to have an understanding of histopathology. The other thing, does anybody know what is the difference between histopathology and cytology? What's the difference between those two? Okay, well, hist is pertaining to tissue. So histopathology is when they will look at a piece of tissue. And then, yes, Alyssa, cytology is looking at the cells. So sometimes when we send a sample, now when you look at tissue, which is histopathology, there are cells that you're looking at in the tissue, but sometimes we'll do what's called a fine needle aspirate. And that's where you put the needle in an organ and you just suck out or aspirate some cells and you squirt it on a slide and you just look at the cells. So anytime you take a piece of tissue, which is a biopsy, you're looking at the tissue layers. It's kind of like, I know I used to use my cake analogy with you guys, like when you take a piece of cake and on the top you just see frosting. But when you cut the cake, you're like, wow, those are 3 layers. Is it one giant layer of cake? Is it 3 layers? Is it 2 layers, if that makes sense? When you take a biopsy of tissue, you're looking at layers of tissue. And you are going to look at those cells and the tissue. But if I was to just take some of the frosting off the top and, you see what maybe my cake analogy makes sense, maybe it doesn't. But if you're looking at cells, you're just aspirating cells from an area. But usually on necropsy, they do both. They'll look at tissue pieces, and they will also look at cytology, which look at the cells. Usually there's bacteriology, which this is when we start to take cultures. And, we have to say, was there a massive infection that caused, a pneumonia? So if you think it's pneumonia, they might want to culture the bacteria to help figure out, maybe if a puppy dies in a litter and all 3 other puppies have fevers and they're on antibiotics, find out the causative bacteria in the dead puppy. That'll help you treat the ones that are alive. So sometimes, you got to do cultures. That's what bacteriology is. Virology is obviously we need to take usually serum samples or blood samples. I mean, you can isolate viruses. Again, I've said you can isolate them from tissues. So usually you'll look at tissues for viruses, but you'll also look at serum and blood. Obviously, any parasitology. And in parasitology, there's probably feces inside the deceased animal. So they can take feces from the intestine. But again, many of these parasites, part of their life cycles, they migrate through the intestine, they migrate through the lungs. And so you may find evidence of a parasitic infection in tissues. And then toxicology. So toxicology, most of the time is going to be blood, and you might be looking at urine. But you can also test tissues for levels of like lead. I think of lead, it just pops in my head. Lead, if you have too high of lead in the blood, you can detect it, but sometimes it'll get absorbed in tissue. So, and toxicology can be very broad, but you're looking for any potential environmental toxins that cause this death. And that also going to have to go to back to the history, about the farm, about where they are. So number 1, before you decide to do a necropsy, right off the bat, do you have permission? So hopefully that's already been decided, but there's nothing worse than starting to cut open an animal and then the owner is like, I didn't tell you you could do that. I didn't give you permission. Um, that's going to be bad. So usually you need to get that permission up front. And I'm always a big person on have them sign something, because verbal can always be misconstrued. But there's usually, most clinics have some type of, when you're given like at BCA, all of our financial estimates, they have built-in consent for procedures. So normally when they're presented with, this is what a necropsy costs, if you sign on the dotted line, you're agreeing to the fees, you're also agreeing to the procedure. So make sure that. Also, make sure you have the correct animal. So does the species, the breed, sex, any special ID, a lot of animals, if they had a microchip, that can be used. A lot of animals in research and in farms have an ID tag or have a USDA number. So most animals have an identifying, I think about clients, if this is an owned animal, they probably don't have a fancy number, but if they had a microchip, you could scan the microchip and confirm, yep, that's the correct animal. But, markings are good, and make sure that everything is marked for the owner. Now, one thing, there's a note under here, it says preference for disposal. The problem with necropsy is if an owner wants to have it done, it has to be done on fresh tissue. They cannot be frozen. So we need to do this ASAP. Like if someone brings you, say they lived on a farm and they found their dog 2 days ago that died in the field. At that point, it's probably too late. I mean, you could potentially open it and do what's called a gross necropsy, but as far as sampling blood or tissue or cells, you're not going to be able to do that because the tissue's already begun to decompose. So the most you could do is you could cut them open and go, oh yeah, they bloated. We saw their stomachs twisted, or their spleen, or their heart is super enlarged, if you get what I'm saying. But normally they have to, if an animal dies at home, they need to be refrigerated. Now, obviously, if you can't put them in a fridge, you can hopefully get to the clinic. The problem is most vet clinics have freezers. And so you can do ice packs. You can try to put them in something with ice packs, or get them, like I said, one night we drove an animal up to ADDL and we just had to get a bunch of ice packs and keep it in the car to keep it as chilled as we could. At VCA, we have big, we don't have freezers, we have coolers. And so they don't freeze, they're kept chilled. So, so the other thing here is that the bigger they are, the more obese, that generates heat, they decompose. Also, if you had a gut fermenter, like a cow, a sheep, basically the rumen is still active. Even if the animals died, if you think about the microbes in the rumen are still activating, they're still breaking down rumen contents, and that generates heat. So that would kind of complicate it. So they need to be a little bit faster. So how has the body been preserved? You need a good history and make sure, and go over the signs with the owner, like the dog that died in the yard. What happened? Well, the dog was running, we were playing fetch, the dog fell over. Did your dog have a history of passing out, syncope, seizures? Did your dog start a new medication? Did your dog get into anything in the yard? Did your dog eat the trash? Does your dog have access to poison? So you got to think about, like, what happened in this dog's situation? Any red flags? Oh yeah, my pill bottle was opened up the other night on the floor. Ding, ding, ding. Is there anything that you can jog the owner's memory that was abnormal in this scenario. And that has to all be in there. The history about, vaccinations, any recent testing, time of death is going to be huge, or the time of euthanasia. Because again, sometimes an animal is going to be brought to you that's already deceased. Sometimes you're going to euthanize them and then do the necropsy. So that all has to be recorded. I'm actually going to stop there because I know like this is our time. So do you have any questions thus far? Okay.